If you have bad knees, there's an experienced orthopedic surgeon here in San Antonio who can help. Dr. David Vizurraga with TSAOG Orthopedics and Spine. Welcome, welcome.
Thank you, very happy to be here.
All right, so you're new to the group, okay, and you specialize in joint replacement of the hips and knees, which are kind of the two most common replacements, right?
The two largest joints in our body that do most of the weight bearing for our body. So they take the biggest impact throughout the day for you.
Okay, and then so tell us how they both work.
Right, you know, a lot of patients will come in and ask, hey, doc, what is a knee replacement? And they come in literally thinking that they might have, you know, knee surgery where we remove this part of the bone and this part of the bone. I like to tell patients, kind of comforting them, it's actually more like a total knee resurfacing. So if you've ever peeled an apple with a paring knife, you know, you take the knife and you get rid of the peel and you want to leave as much of the fruit behind. That's what we really do with the knee joint. Only we use special instruments to do that. So illustrated here, you can see where the end of the bone on either side is replaced, and we have a special plastic piece that goes in between. That plastic piece, people say, well, or they ask, well, that's just plastic. And I say, well, it's not your Tonka truck plastic. This is some highly engineered stuff. And ideally, it's meant to outlast you.
Okay.
So that's a knee replacement. This is a hip replacement. Typically for these, we do replace the end of the femur bone with another ball and socket area too. So all of these implants, for the most part, they're meant to become a part of you and live and last as long as you can, hopefully, if not longer.
Okay, and so who's a candidate for either one?
Right, great question. So I tell patients, anybody that's having knee pain or hip pain, and the big question they'll say was, well, it hurts, but maybe it's not so bad. If you feel like you're becoming a prisoner to that joint, I don't want to get up and go walk with my family because for the next 3 days I'm going to be miserable, so I decide to stay in my chair all the time. So those are patients that, you know, get up or make a phone call. We're happy to evaluate you and give you some options of what we think would be best for you.
Okay, and we have about 90 seconds left, but what's the recovery process like?
So believe it or not, in the old days it used to be a week or two in the hospital.
Right.
Now we are getting you up same day of surgery. Most of the time we're even able to get you home same day of surgery, maybe one night overnight in the hospital, but you're working with physical therapy right away. You're going to have some pain control that you want to have, some pain medications, but for the most part you're up and at 'em. We're not actually asking you to run a marathon, but we do want you to get up and try and use the joint, move it. Motion is lotion.
And any tips for folks who might not need surgery but, you know, kind of need to take care of their knees?
We all look at these on a case-by-case basis. While we're all surgeons, we like to think that surgery is actually our last option. So we have a litany of options that we can take you through that would be anything from a simple pain medication, lifestyle modification, weight loss, diet modification, to putting medicine inside the joint to help maybe ease the pain at the source. So we have other options that we can use besides surgery to try and see if we can make your joint pain better.
Dr. David Vizurraga with TSAOG Orthopedics and Spine, thank you so much. You can book your appointment there at TSAOG Orthopedics and Spine. Just call 210-804-5400. And for more information, visit the website tsaog.com. Doctor, once again, thank you.
Thank you.